So one of the more common things people come in for when they get into a car accident is whiplash, of course, because most accidents are rear-enders. And when people get rear-ended, they are having a lot of neck pain. Headaches are very common with whiplash, and also a lot of stiffness in the neck and shoulder muscles. When somebody's in a fresh accident, they're really sensitive to touch. So in the beginning, it's really light work to get the muscles to loosen up a little bit. Everything initially is going to tighten down, go into spasm even sometimes, because the body's trying to protect itself. So our job is to kind of slowly but surely get the body back to normal function. We try to loosen up the muscles, try to get the joints moving the way they're supposed to be. And initially you have to be really, really sensitive because the tissue is literally, strained or torn. So we'll do some light muscle work on the neck. And I always check in with my patients and just ask them, is that pressure okay? Danny, you doing okay?
Yep.
That's not too much tension on you?
No.
Okay. And I always tell people, I'm never gonna push you past your tissue limit, but make sure you tell me if it's too painful, because I never wanna make somebody hurt. I mean, some of it's a little bit of pain for gain, but not to the point of them almost being in tears. That's not really gonna help them. Again, just some light work on the muscles of the neck, especially at the base of the skull, because the headaches that come from a whiplash injury or from the tight muscles up at the very top of right up at the very, very top of the skull here. So it's important to really, really loosen these muscles called the suboccipital muscles up after an accident. Okay, and one of the muscles that really gets injured a lot is this muscle here, because if somebody's hit from behind, and especially if they anticipate it, they're gonna have that muscle tense, and then the first thing that's gonna happen is their head's gonna go backwards, and it's gonna strain that muscle. So one of the more common symptoms from whiplash is not only soreness here, but also that sensation of feeling like heaviness of the head, like their head's too heavy to be supported by their muscles. So there's a sense of heaviness of the head. So after we do some muscle work on these muscles, the SCM muscle, the upper trap muscle, the base of the skull, and the neck muscles, and then we'll go in and do a really light adjustment. Let that neck relax completely. You doing okay?
Mm-hmm.
Okay, nice and relaxed. Nice and easy. And then I like to do a little traction afterwards, just because A, it feels good, and B, it kind of helps stretch out the long muscles in the neck a little bit. If you were in an accident recently, like say within the last month or 3 months, and you find that you're still having some pain that could possibly be related to that accident, then go ahead and give my office a call, and we'll get you in, get you examined, figure out what's going on, and start treating those injuries and get you back to what you were feeling like prior to that accident.